We proudly welcome you to Aziz Mom and Child Community Service 2021, organized by AMSA UPM. Greetings are due to the committee board of this program, the honorable speakers, Madam Indrani Saminaban, and Professor Dr. Jody Malay Panandi, and also to participants. I am Safia binti Muhammad Ayub, your host for today. The Asian Medical Students Association of UPM is once again back with another exciting and engaging session, which is the Alert.Calm.Safe program. The purpose of this session is to educate participants regarding child first aid and safety. Now, allow me to explain totally about the scope of this session to overview. This program will be kicked off with an informative talk from our two honorable speakers, Madam Indrani and also Professor Dr. Jody. A Q&A session will then be held afterwards. Let's get to know more about our speaker of this session. First, let me introduce the speaker, Madam Indrani Saminaban, a professor who worked at the Department of Trauma and Emergency in University Malaya Medical Center. She had done her higher education in Bachelor of Nursing Science with honors in Pediatric Advanced Life Support. She has been a member of St. John Ambulance, Malaysia since 1972 and is currently appointed as the Chief Nursing Officer. Our second speaker for today is Professor Dr. Jody Malay Panandi, a PhD holder. She used to teach in UPM as a professor until 2017. She has been a member of St. John Ambulance Malaysia since 1971 and First Aid Trainer 1989. Currently, she is holding the position of Principal Staff Officer for Community First Aid. If participants have any questions during the talk, feel free to drop them at the chat box to be answered during the Q&A session. So now, let us welcome our first speaker, Professor Dr. Jody Panandi.
Thank you, Ms. Safia. Good afternoon, everyone. And to all the mothers and those who are playing the roles of mothers, I wish you happy Mother's Day. Today, our presentation on child first aid is dedicated to all of you. I shall start my presentation now. Today, Miss Indrani, Saminathan and I are very happy to share some information on child first aid with you. However, before we start this presentation on this topic, I would like to share with you some things about the organization which we represent, St. John's Ambulance Malaysia. St. John's Ambulance Malaysia is a voluntary non-profit organization started in Malaya, the then Malaya, in 1908. Our motto is for the service of mankind. One of the main things we do is teaching first aid. We aspire to teach first aid to as many individuals of the community as possible, with the ultimate aim of having one first aider in every home and one first aid squad in every school, workplace, and in fact factories, that is factories and offices. We also, our members who are qualified first aider, render first aid services during gatherings and public events, such as sports events, parades, and social gatherings. We also provide community healthcare services. We have a number of hemodialysis centers throughout the country, catering for those with renal failure. We have one nursing home. Our members and healthcare providers who volunteer with us provide free health screening. We also have mobile clinic. Most of our services are catering for the ordinary people, particularly those of the lower income group and those in rural areas and also the Orang Asli. We also provide other kinds of community services, as you can see in the picture, especially when there's a disaster or when there is a need. One of the activity we have regularly throughout the year is a nationwide blood donation drive. We have it at all states at the same time, and this is repeated a number of times. So when you hear announcement of this, please do come and donate blood. St. John's Ambulance Malaysia is known for its ambulance services. We have non-emergency ambulance services throughout the country. This is providing ambulance transport to and from home to hospital or across states. We have also 24-hour emergency services, but this is limited to only some areas because this would need full-time staff. As you can see in the picture, our ambulances are quite well equipped. During the current COVID-19 pandemic, we have undertaken a number of initiatives. Our members have actually made facials and worked with volunteer tailors to prepare isolation gowns, head and shoe covers, and these have been distributed to a number of hospitals in urban area as well as district hospitals and health centers. We have also provided ambulance service to transfer COVID patients and also to distribute meals. Currently, our ambulances are at standby at some of the vaccination centers. The organization is also a youth organization with activities for youth development. Our members are trained in first aid as well as caring for the sick in the home. They are taught food drill and discipline. We also have other kind of activity for the members, such as campaign, cooking competition, and our cadet members, those in schools, and actually collect proficiency badges by undertaking courses and tests in particular skills. Our members are all volunteers, working dedicated to the service for mankind. Our activities, our operation, and all our programs, community service programs, are carried out based on the kind contribution of generous individuals, government grants, and company sponsorship. Once a year, we have a month-long flag day where our members go out with these cans and they collect donation from public and sell car stickers. We also organize fundraising dinners, concerts, and food fairs, but during this pandemic period, the later activities are not possible. I would like to take this opportunity to thank all those individuals and companies and our government who have supported us financially or in other way. Thank you very much. It is you who have made us able to provide service to the community. Here, I've displayed the contact number for our national headquarters as well for the Wilayah Persekutuan Kuala Lumpur headquarters. In case you need our service, you can contact the headquarters, either one, and in case you want to donate some money, you can also contact them. And the websites are provided for you to get more information about the organization. Now I shall go to the topic for today, child first aid. Why is child first aid important? Why do we need to know about child first aid? For those who are parents and those who have take care of children and who have children, siblings, little ones around, you will know children are so active, they are full of energy, and they are very curious. As a result, they encounter many kinds of injury. They get hurt, there's little wounds and bleeding, bruises. Sometimes they touch something hot and get burned, and in most serious cases, they can become unconscious. So it is important that those of us who have children and those who are working with children, and even if you are not with children, working with children, we should know how to help them in case need arise. Here's also, I want to share another report in the papers. Boy chokes to death on rambutan seed. In the school, teachers' staff room, because no one there knew how to help him. So the focus of our presentation today will be on purpose and priorities of first aid, management of wounds and bleeding, choking in child and infant, CPR for child and infant. The first two topics I shall be doing. The last two topics Ms. Indrani will be doing. Priorities of first aid. What is first aid? First aid is the initial help given to someone who is injured or taken ill until he gets medical help if necessary. Why do we need to give first aid? The purpose of first aid: to preserve life, to prevent further injury or the worsening of the condition, and to promote recovery. We can achieve these objectives by adopting 5 actions, which we shall call as priorities in first aid. These are: first, assess the situation. Protect yourself. Assess casualties condition. Give appropriate first aid. Arrange appropriate help or transfer. I shall go through this one by one. Now, assess the situation. When something happens, before we render help, we should first assess the situation. And what do? We ask what happened. And the first thing we must address is there any danger? Is there any danger to me if I go to help? Now, does it mean there is danger we don't help? No. If our children, even if it's our own children, we have to assess for danger before we help. Now, if we see danger, then we need to protect ourselves. We need to make it safe for us to render help. We need to make it safe for the others around, the bystanders, and we need to make it safe for the one who is injured. So make it safe. How do we do this? We can use, this is for ourselves, we can use personal protective equipment, PPEs, such as gloves, face masks, face shield. And under the current pandemic, this is something we should all remember to use when rendering help to someone we don't know or someone we suspect is infected. If outdoors, by roadsides or even in the road, we can use these hazard barriers to make it safe for us. When you don't have the ready-made hazard barriers, we can improvise, like using any cloth, preferably red cloth or branches as barriers. I just put in this picture to show you a simple thing like electrocution. If you want to help, we should remember, don't just touch the child, but first turn off the power, break contact with the power, and make it safe, because you don't want to become another victim. Next, after we have made it safe and protected for ourselves, now we help the casualty or the one who is injured or sick. We assess the casualty's condition. We do this by two approaches. One is conducting primary survey or examination. Next, secondary survey. I shall explain each of this. Primary survey is to detect life-threatening problems. And this is done by using this acronym, Doctors ABC, DRS ABC. D stands for danger, R response, S short for help, A airway, B breathing, C circulation. I shall go through this one by one, but I've done on danger, so I will skip this. So we shall go straight to response. First thing, when you see someone lying down, we check for response. That means we want to check whether the person is conscious or unconscious. We check for response to our approach, our voice, our touch. So you call them, are you okay? And you tap firmly on the shoulders while doing this. If the person responds, can answer you or turn to you or move, then there is response. And we classify this response as the individual as alert. That means even when you approach, the person moves or says something. Or when you approach, there is no response, but it responds to your voice, or responds only to the firm tapping on the shoulders, that is response to pain, or is unresponsive. That means he doesn't say anything, doesn't open his eyes, doesn't move, which means is unconscious. And that is a serious condition, because we do not know when a person is unconscious whether they are breathing and the heart is beating. But when the person is conscious, we know they are breathing, and he or she is breathing, and the heart is beating. So when a person is unconscious, unresponsive, or even when a person is conscious but seriously injured, we will send for help or shout for help. In Malaysia, our emergency numbers have been consolidated into one number under the Malaysian Emergency Response Service, MERS, and so that it is convenient for the public. Our emergency number is 999, not what we hear on TV, 911, it's 999. Every country has its own emergency number. This number can be used on landline as well as on handphone, but handphones also have their own number, 112. 112 is a worldwide emergency number for mobile phones. That means any country you can use this number, and this number works even though you don't have any credit, as long as you have a valid SIM card. Next is airway. When a person is unconscious, this you only do if a person is unconscious. In unconscious airway, in an unconscious person, the tongue, which is a muscle, lacks and it falls at the back of the throat, covering the airway. So we must make sure the airway is open so oxygen can enter to the lungs. To do this, we do a head tilt chin lift. By doing head tilt chin lift, the tongue is pulled up and the airway is clear. And some individuals, it was just this problem. After that, they will be breathing normally. So we have done D, R, S, A. Next is B. After you have opened the airway, ensured airway open, and still maintaining head tilt chin lift, we check for breathing. We look for chest movement. We see whether there's any reaction in the face. We look at the person. If there is no chest movement, there's no normal breathing, then we go to the next, which is maintain circulation. We do an external chest compression. Miss Indrani will be going into more detail on this, which is CPR. So I shall not touch this. So this is primary survey. Next, we do the secondary survey to discover injury-related problems that do not pose an immediate threat to survival, but may do so if not attended to. This we do by adopting these three approaches. First, history. We ask the individual if the person is conscious or the people around what has happened. You can, whether the child has any medical history. Then symptoms. Symptoms is asking the child, how did they feel? Do they, the child can say, I feel pain, I feel dizzy, I feel like vomiting. Those are sensations that the individual feels that we will not know unless they tell us. And we look for signs like bleeding, swelling, deformity, redness, pallor. So based on this, we can make diagnosis what is wrong, and then we can render the appropriate first aid. This is an awareness course, so we are not going to go into specific things except for 3 topics. Then we arrange appropriate help. It's not necessary, you call for an ambulance and get them to the hospital. It depends on the condition. If a person is unconscious or has been unconscious, yes, they should be sent to a hospital. Otherwise, sometimes the person just needs to rest, or you need to take them to a hospital, but you can do that using the car. So that covers priorities of first aid, which is assess the situation, protect yourself, assess casualties condition, give appropriate first aid, and arrange appropriate help. Now we are going to meaning Ms. Indrani and I, are going to address only 3 conditions where and what kind of help we need to give. The first one, which I'm going to do, is management of wounds and bleeding. Wounds and bleeding is very common in children and also in adults. That's why, we felt that this we should talk about. So we are going to just address how to manage wounds and bleeding and how to control bleeding. So when there's a wound, there is blood. How do we control bleeding? We adapt 2 approaches: direct pressure and elevation. Make sure you're protected, especially if you're going to touch the blood of a stranger or someone, not a stranger, but someone you do not know whether they are infected with any, diseases. Press on the wound using, some soft absorbent material, gauze, a towel, thick handkerchief. Direct pressure will constrict the bloods in the area and slowen blood flow and help blood clot. Elevation, raise the part that is bleeding above the heart. That means hand raised up, leg, let them lie down with their leg raised up. This way, blood flow is against gravity, so it's slower and reduced. Now, how do we manage the wound after you have controlled bleeding? If it's a slight bleeding, small wound, quite common this, we need to first clean the wound and dry it so that there is no infection. Then we need to disinfect. You can use any of the wound disinfectant that you can get from the pharmacy. You should have one of these in your homes. And then dress the wound. If it's a small one, you can use an adhesive tape, adhesive plaster. Slightly bigger one, the size of the adhesive plaster may not be enough. You need a gauze and put a plaster on it. Wounds with severe bleeding, when there's lots of bleeding. Now, this child you have to take to the hospital. It's severe bleeding. You have to control bleeding. That is our main priority. Our priority is not to prevent infection. So we don't wash, clean and dry. We control bleeding using direct pressure and elevation. I just want to add something which I didn't mention earlier. When you apply direct pressure, you do not apply direct pressure if you see something embedded in the wound. Then we dress the wound. When there's severe bleeding, we would dress a wound using gauze, any soft absorbent material, and with a bandage, because a bandage will exert pressure over the wound and help control the bleeding. And we still elevate the injured part to control bleeding while this child or individual is taken to the hospital. Sometimes the bleeding occurs under the skin. The skin is not broken, so there's no wound, but there's bleeding under, and this we call as a bruise. When there's a bruise, how do we manage? We apply cold compress for at least 10 minutes. The ice on the skin will cause constriction of the blood vessels and reduce the flow of blood in the area, and so the bruise will be restricted to a smaller area and until blood clot is formed. Okay. That is about what I'm going to cover. We are only doing the basics. Of course, there are more complications that can occur in wounds and bleeding, but this is an awareness course, so we are just touching briefly. If you are interested in more details, you should go for a proper full course. If you have any questions pertaining to anything I've covered, you could post it and we will answer during the Q&A session. Before I end my session, I would like to summarize what I've covered. Remember, doctors ABC, DRS ABC. In any situation, when you're rendering help, remember danger. If the person appears to be unconscious, then check for response, shout for help, ensure open airway, check for breathing, and if necessary, maintain circulation. Then render the appropriate first aid. If there's bleeding, control this by direct pressure and elevation. Bruise, apply cold compress. You tell them. You need to know child first aid, because if you know that, you can be alert to the problem and the need, and you will be calm in case a child gets injured or sick, and you will feel safe, and the child will feel safe knowing that you are one who knows first aid and will be able to help him or her. Thank you.
Do you have the slides, right?
No, I took one up, that's why.
Yes, everything probably can see like this.
You told me.
Am I on now? Present now. Present now. Very good evening. I'm Ms. Indrani here. We are going to proceed with child choking now. My presentation will have a presentation followed by a video. And if you have any questions, you can go to the chat and we'll advise you after that. So I'm going to present now. Where do I get the slides from?
This. That's just like, and then click on this. You share that.
Okay, we are going to talk about choking, both in infants and children. Okay, so basically choking. Share. Share.
Yeah.
Yeah, it's coming up.
Your voice
I can hear on my phone.
voice come up.
Okay. Sorry for the interruption. So we'll start with choking for infant and children. Yeah. So as we know, one of the commonest problem among children and infant is choking. And when we talk about choking, there are two categories for choking. It's either a mild choking or a severe choking. So initially, as a parent, you should be able to recognize is your child having a mild or a severe choking. In case of a mild choking, it is only partially blocked, which reduces the flow of air to the lungs. And here you could hear your child crying or coughing, but not very loud and clear. Whereas if it is a severe obstruction, of course, the child will not be able to speak, cough, and breathe. So that will indicate whether the child is having a mild or a severe choking. So when you approach a child who is choking, so as I said just now, we have to assess the severity. Is the child able to cough or unable to cough? If the cough is ineffective and if the child becomes unconscious, there are the two steps that we must do. And what if the child is able to cough? Then we can help the child in the second mild cough. If you find the child is unconscious, just help to open the airway of the child and give 2 breaths, and we will start CPR. Later on in my CPR session, I will let you know how CPR is performed. For now, when you find a child who is stuck with something in the airway, what we encourage you to do is give the 5 back blows and the 5 chest thrusts. Okay, so this is how it is been performed on a child. You can either sit down and have the child across your lap and encourage the child to cough, failing which you can give 5 back blows between the shoulder blade high up and then followed by the 5 Heimlich maneuver. And if at all the child becomes unconscious, then we shall proceed with CPR. Okay, so if the child is still conscious and if he or she is able to stand, we stand the child and then we can give the Heimlich maneuver by placing our fist just above the belly button and giving a good thrust so that that can help to bring out the foreign object that is stuck. Okay, for the infant, we have to turn the child face down and give 5 hard back blows between the shoulder blade, turn the child to the front and give the chest thrust. If they become unconscious, then we'll proceed with CPR. So now we will watch the video on CPR, on choking for children and infants.
Stop sharing, stop reading. Stop sharing, escape. Where's your okay, share.
Chat.
Okay. It's not there. Can you see whether it's there?
What to do and so on, yes.
Is it there? Does it work? No. See if they can hear the video. No. You know why? Their one is a different one. Then go, the tab is not here. Let's go here.
Are they playing? The video has not been shared.
Wait, I'm going to do.
Pull the children. Shall we play the others?
Yeah, the choking.
Choking, huh?
The number 2A, 2A and 2B. Because they're not using these, they are using these. I prepared Google.
They're in streaming.
No, this is. Are they playing?
If you think an adult or child is choking, ask them, are you choking?
Yes, isn't it?
Yes.
Cough it out. If they are coughing, encourage them to continue as they may be able to remove the
Yes,
obstruction. If they're unable to speak or cough, they need your help straight away. If coughing
Wait,
doesn't work,
wait.
slap it out. Support the upper body
Yeah.
with one
Yeah.
hand and the heel of the hand to give up to 5 sharp back below the shoulder blades.
And this is what they're presenting.
Then check to see if there's anything in the mouth. If there is, tell them to take it out. If back blows don't work, try giving up to 5 abdominal thrusts. Squeeze it out. To give the abdominal thrusts, stand behind them. Put your arms around them and link your hands between their tummy button and the bottom of their chest. Clench your lower hand in a fist. Grasp your fist with your other hand and pull sharply inwards and upwards. Repeat up to 5 times. Check their mouth. If they're still choking, call 999 or 112 for emergency help. Use a speakerphone if you can. Keep repeating the 5 back blows and abdominal thrusts until blockage clears or help arrives. If they become unresponsive, open the airway and check their breathing. If they're not breathing normally, start CPR. So remember, if someone's choking, cough it out, slap it out, squeeze it out. If it's not cleared, call 999 or 112 for emergency help. Keep repeating the cycle. Start CPR if they become unresponsive, and that's how we treat choking. If this video has been helpful to you, help support St John Ambulance by going to sja.org.uk/donate. As you start weaning your baby, small items of food may get lodged in their throat and they may choke. They can also choke on small toys or household items. If a baby under 1 year old is choking, you'll notice that they'll be unable to cry, cough, or breathe. What we're going to do now is administer some back blows. So first of all, you need to lay your baby face down along your thigh, making sure you support their head and their neck. Next, we're going to administer those directly between the shoulder blades using the heel of your hand. Give up to 5 sharp back blows, making sure after each one, whatever it is, hasn't come out. If the back blows don't work, we now need to move on to giving some chest thrusts. So we need to turn them over so they're lying face up. Again, making sure that their head and their neck are supported. Put 2 fingers in line with the armpit in the center of the chest and pushing down sharply, administer up to 5 chest thrusts. If this doesn't work, call 999 or 112 for emergency help. Repeat 5 back blows and 5 chest thrusts until help arrives. If they become unresponsive, you will need to start CPR. So remember, if your baby is choking, check the mouth, slap it out, squeeze it out. And that's how we treat a choking baby. Thanks for watching. Help support St. John Ambulance. Donate today.
Thank you for presenting the video. If you have any questions as regarding to the choking, you can post it and we will respond to it in the Q&A. Now we shall go on to the next slide, which is on CPR.
This one, this last one.
No, not this one.
Close this.
Okay, CPR in short, it means cardiopulmonary resuscitation. Generally, when we speak about cardiopulmonary resuscitation, cardio is a Latin word for the heart, pulmonary, we are talking about the lungs, and resuscitation is the process or procedure that you are going to carry out. In 80 to 95% of cardiopulmonary resuscitation that happens to infants and children, they are not related to the heart, they are rather related to the breathing, the lungs. Normally, the child will go into cardiac arrest due to respiratory arrest rather than the heart getting a problem. If the child is born with cardiac problem, it's a different issue totally. Otherwise, majority of the children go into cardiac arrest due to respiratory problem. So this is the very important chain of survival, as what earlier Dr. Jyoti has mentioned about the DRS ABC, which is very vital in first aid. The chain of survival in CPR is another very important link. As far as possible, we must do our best not to break the chain between. So it starts off with prevention. Since they are small young children, as parents, we have to make sure that we take the necessary precautions to prevent such mishap happening. If at all something has happened, then we go on to the early CPR. And please get help. We can't manage alone. And when you get help, they should come with the AED. Okay. So as we all know that our brain cells, they will start dying as quickly as 4 minutes. So the importance of oxygen is very much needed, especially in younger children. So when a child or a baby collapses, at the moment of collapse, there is still oxygen in the system that will help. But if the delay is more than 4 minutes, with no oxygen around, then there'll probably be an irreversible brain damage that will cause a clinical death. But if the delay is more than 4 minutes, it happens for about 10 minutes with no oxygen, then the degeneration of the tissues happen, and we call that the biological death. So our main aim here is back to your ABC to make sure that the air passage is open and the child is getting enough oxygen. Okay, through surveys, it has shown that immediate action is very, very essential to save life, Because if you look at the graph here, it shows you that as early as the second or third minute, the chances of survival gets much lesser. So the first 1 or 2 minutes is really very critical. Make sure you could help the child as immediately as possible. So for us to perform the CPR, we will go back to the algorithm of the DRS ABC. So starting off again is danger, making sure that yourself, the casualty is all safe. You do not become the second victim. Check for the response. If there is no response, get help. Then this is how you open the airway by head tilt, chin lift, okay, by placing your 2 fingers at the bony part of the lower jaw and the other hand at the forehead and tilt the airway open. Then you check for breathing. Is your baby or is your child breathing or not by looking at the movement of the chest. Failing which, we are going to start our CPR, the compression. Okay, so the AD is more applicable for children above the age of 8. Below 8 and infant, you don't really need to use the defibrillator. So this is the algorithm, the protocol for pediatric CPR. When you find a child not responding, call for help, open the airway. If the child is not breathing, we will start off with the rescue breath. Whereas in adults, we teach you hands-only CPR because, as I told you earlier, the cause of cardiac arrest in children and infants is more related to respiratory problem. Therefore, it's very important that we give the 5 rescue breath, followed by the 30 compression, which is done for 5 cycles over 2 minutes. Okay, so this is the children's CPR, 30 compression, 2 inflations, 5 cycle in 2 minutes. The amount or the depth of compression should be 1/3 depth of the chest. Using one hand, when we say using one hand, you use the heel of the hand and you can compress about 100 to 120 times per minute if you do not wish to give the ventilation. The same protocol will be used in infant, again 30 compression with 2 inflation, but the difference between the child and the infant is in children you are using one heel of your hand, whereas in infant below the age of 1 you are only going to use 2 fingers and you're also going to compress 1/3 depth of the chest, and your compression rate is going to be between 100 to 120 times in a minute if you are not giving the inflations. Now, how long and when are you going to stop the CPR? Okay, so the protocol says stop CPR if the victim, the child or the infant regain consciousness, or if help has arrived, ambulance have arrived, then you can hand over the casualty to the paramedics or whoever have come for your help, and if you are totally exhausted. Okay, with that, we conclude our topic on CPR. So to give you a clearer picture of what I've just explained, we will watch the video on the CPR now.
If after performing a primary survey, you find a child who is unresponsive and not breathing normally, call help. Ask someone to phone 999 or 112 and ask them to bring an AED if one is available, while you begin CPR immediately. If you're by yourself and do not have a speakerphone, start CPR with 5 initial rescue breaths, then 30 chest compressions and 2 rescue breaths for 1 minute before calling for help. To give rescue breaths, open the airway by tilting the head back with one hand on the forehead and 2 fingers under the chin. tickle any obstructions from their mouth to clear the airway, only if you can clearly see something. Keeping their head in this position, pinch the soft part of their nose, allow their mouth to fall open. Take a deep breath and see their mouth around theirs. Blow steadily into their mouth, giving a rescue breath in about 1 second. The chest will rise. Remove your mouth from theirs and watch their chest fall. Give them 5 initial rescue breaths at about 1 breath per second, like this. To do chest compressions, kneel on by the child beside their chest. Place only one hand on the center of the chest. Lean over the child with your arms straight and press down vertically 1/3 of its depth. Release the pressure. Allow the chest to come back up without removing your hand from the chest. Repeat this to give 30 chest compressions at a rate of 100 to 120 beats per minute. This is quite fast, and to help you can sing Nelly the Elephant, which can help you to keep up with the pace. After 30 chest compressions, open the airway and give them a further 2 rescue breaths. Continue to alternate between 30 chest compressions and 2 rescue breaths until help arrives. If you're on your own and don't have a speakerphone, stop after 1 minute and call 999 or 112 for emergency help. If a mobile phone is not available and you have to move to get a telephone, take the child with you if you are able. Do not leave the child to look for an AED. The emergency services will bring one with them. If there's someone there who can help, if they have brought an AED, ask them to turn it on and follow instructions while you continue CPR. If they can help you perform CPR, you can swap over every 1 to 2 minutes with minimal interruptions to chest compressions. Continue CPR until emergency help arrives and takes over. The child starts to show signs of becoming responsive. They start breathing normally or opening their eyes, or you become too exhausted to continue. If they do start breathing normally again, put them in the recovery position. So remember, if you come across a child that's unresponsive and not breathing normally, call for help. Tell a helper to call 999 or 112 straight away and ask them to bring an AED. Give 5 initial rescue breaths, then 30 chest compressions followed by 2 rescue breaths. Continue giving 30 chest compressions to 2 rescue breaths until help arrives or the child starts to breathe. And that's how we perform CPR on a child. If this video has been helpful to you, help support St. John Ambulance by going to sja.org.uk/donate.
If you ever find your baby is not responding to you, you will give them the best chance of survival if you know what to do. If you have found your baby unresponsive and not breathing normally, you will need to perform baby CPR. Call for help. Ask a helper to call 999 or 112 for emergency help. Use a mobile speakerphone if you're on your own so you can start CPR as soon as possible. If you're on your own and you don't have a speakerphone, you need to do CPR for a minute before you can call for help. Place them on a firm surface and open their airway. With one hand on the forehead, gently tilt their head back. With your fingertip, gently lift the chin to open the airway. Pick out any visible obstructions from the mouth and nose. Step 1 is puff. Take a breath, put your lips around your baby's mouth and nose and make a seal. Blow gently and steadily for up to 1 second. The chest should rise. Remove your mouth and watch the chest fall. That's one rescue breath or puff. Do this 5 times. Step 2 is pump or chest compressions. Put 2 fingers in the center of your baby's chest and push down 1/3 of the depth of the chest. Release the pressure, allowing the chest to come back up before pressing back down again. Repeat this 30 times at a rate of 100 to 120 pumps per minute. This is quite quick. After 30 chest pumps, open the airway and give a further 2 puffs. Continue to alternate between 30 chest pumps and 2 puffs. If you're on your own and don't have a speakerphone, stop after 1 minute and call 999 or 112 for emergency help. If a mobile phone is not available and you have to move to get to a telephone, take the baby with you. Keep repeating 30 pumps, then 2 puffs until help arrives or they become responsive. So remember, if your baby is unresponsive and not breathing, call for help. Ask a helper to call 999 or 112 for emergency help. If you're on your own, use a speakerphone and start CPR as soon as possible. If you don't have a speakerphone, do CPR for a minute before calling for emergency help. Give 5 initial puffs, covering both the nose and mouth, then 30 chest pumps with 2 fingers to the center of the chest. Continue CPR with 30 pumps and 2 puffs until help arrives. And that's how you do baby CPR. Thanks for watching. Help support St John Ambulance. Donate today.
Thank you for putting up the video. With that, it concludes the presentation on choking and CPR. I'm sure the video is very much clearer. We hope that all whoever is following this have understood. And if you have any question, please forward. Thank you.
That's such a big question. I think I can consider maybe all the participants have learned a lot from the sessions that I have. Despite the explanations from our speakers, I believe some of us have feedback and thus the Q&A session will now begin. Participants can drop your questions in the chat box.
If you can see question first. Can't see it.
You can go to the chat. You don't see anything.
No, but they are not using this, they are using YouTube. Maybe they are using the present because they YouTube.
But just now I saw this question, shall we play? But nothing else.
This is only for us. You got no question?
390.
Oh. I think all very good students.
We now have our first session from Taiwan. The head teacher, can you know if the CPR varies for pregnant ladies?
You know, if CPR varies for pregnant ladies. Yes, the CPR on sorry. Oh, CPR for pregnant ladies, there's no variation. We still do the same for as adult CPR. So as we told earlier, the priority in children is respiratory arrest, but the priority in adults could be related to heart. And you can straight away, when you do your DRS ABC, if you don't see any movement, then you could straight away start with compression. is either 30 compression with 2 ventilation if you are willing to give the breath. Otherwise, it's 100 to 120 compression, which you will be compressing at the middle of the chest to about 2 inches. And not forgetting to allow chest recoil, which you can only understand what I'm saying if you take a proper CPR course. Thank you.
When you're doing CPR, you are compressing at the chest. Whereas someone is pregnant, the fetus is at the uterus, is lower down. So compressing at the chest would not affect a pregnant person. Doesn't matter which state of pregnancy. However, for choking, yes. Choking for pregnant person would be different from choking for child. Choking child and choking adult is the same. But in choking, you are applying thrust at the abdomen. So in pregnant lady, especially late pregnancy, you will be applying the thrust at the chest.
The God of thunder is this. How to avoid the risk of fracture ribs. Fracture ribs.
This is your topic.
Okay, not to worry about the fractured ribs because it will not interfere with your compression. Your compression is going to be at the sternum, the middle of the chest. Not to worry, even the ribs break, you can still continue with the CPR. Okay. Are we able to do CPR even we do not have the license or certificate? Yes, you are allowed because to just do compression to save someone's life, you don't need a license, but at least you must know what you are doing. So it will be ideal if you have attended an awareness program or a mass CPR program, or if you have taken a full CPR course. I think that will give you the confidence when you are doing the compression. Are we able to do mouth-to-mouth resuscitation in the pandemic era? As St. John personnel, we do not advise you. But if it is your loved one, your parents, your child, you are willing to, you can use a barrier if you have to provide the mouth-to-mouth. If it is a stranger who you do not know, our advice to you is no. What do we do if Heimlich maneuver patient you cannot make condition worse? You can only help if you are doing the right technique. I don't think so you will make condition worse, but your intentions are good, so not to worry. Please continue performing the CPR until help comes. Don't forget, please call for help before you start your CPR or your Heimlich maneuver.
Let me continue with that. We do CPR for the person whose heart has stopped breathing, and brain cell is going to start occurring, and brain cells will die in 4 minutes. If you don't do CPR, then this person is going to definitely die. So you can't make condition worse by just doing CPR. And the same for Heimlich maneuver. If a person is choking and full, that means they are not receiving oxygen. If you don't have dislodge that whatever is in their airway, this person is going to become unconscious and is going to become, there's no breathing, no heart is going to stop, and they will require CPR. So you cannot make them worse. You will only help them. Okay, there's a question. How a deaf person contact a sick? Yeah, you can, use SMS. If they have a phone, I'm sure the deaf people, their phone, they have the apps adapted for specific uses. So they will know, and the operators are trained. Really, they are the operator who handles the 999 call. I've made calls both for police and ambulance. They know the right questions to ask. They are trained for all this situation.
The common injuries the child is prone to, and how can we help them? To the question by Fire Glory, you're really fire. What is the common injuries a child is prone to, and how can we help them? Commonly, what we find casualties that turn up at our emergency department is quite often it is falls. Okay, common injuries are falls with fractures. And we do get a couple of children coming in with foreign bodies being inserted either into the nose or the ear. So choking, we don't see many, but foreign body putting into other orifices is there. So we get some cuts and bleeding, and quite common is falls with fractures.
There is one question earlier by Nurul Suraya: how to avoid the risk of fracture risk?
So the
Okay.
CPR, related to CPR.
Okay, it is how your hand, very important, the positioning and your hand, that will reduce the risk. But if there was a fractured rib, don't worry about it, because this person needs oxygen and you are trying to ensure they get enough. Anything we missed?
How do we join? No. Belaya. Saras.
You can join. One of the things about our membership, unlike others, in St. John's, to be a member of St. John's, you have to go through a basic first aid course, take the assessment, and pass before you can even wear any uniform. So that is a requirement. I'm not telling that to scare you. I'm telling that to just tell you that, so all our members are qualified first aiders. But what you need to do is contact, depending on where you are. I have given you the contact number and for the national headquarters and the Wilayah headquarters, and you can contact them and tell them the interest. If you are not in KL, then you can contact the national, and they will give you the state contact headquarters, and they will help you and tell you how to become members. We also have another program called Rakan St. John. These are those who don't want to go through a first aid course and become qualified first aid members, but they want to join us in one of our activities and help us, like during our blood donation drive, or even when we go out to the health screening. These individuals can actually join our Rakan St. John's. That too, please contact the headquarters and they will be able to help you with this.
Okay, to the question by Ng Chi Han, a suggested duration for checking of pulse in primary survey, both pulse and breathing, you should take nothing more than 10 seconds. 5 to 10 seconds is the time allowed for you to check on breathing. But for lay people, we do not emphasize on checking of pulse unless you are a medical professional. Okay. How can we ourselves choke and no one is nearby? Is there a self-Heimlich maneuver? Yes, you can do the same technique whereby you can do your abdominal thrust on your own self. and or heart cough, that could bring the foreign object out. All right, thank you. You're most welcome. Hi, Doctor and Madam. Do we have any specific protocol for CPR during the COVID-19 pandemic?
Yeah, who's in that?
Fire Glory.
Okay, there's a question whether there's any specific protocol for CPR during the pandemic. If you have seen the videos and if you have gone for if you have gone for a basic first aid course, we say when we check for breathing, look, listen, and feel. We ask you to put your ears above the nose and my picture. When I presented, I put a picture. The person is still standing straight up and looking at the chest. We do not. And of course, you have to wear a mask when you are doing CPR, or even if for any other rendering first aid. And if you can, also casualty.
I don't see the question here. I don't see the question here.
But we teach you.
That's why I think to see. Because they say already got respiratory problem, you adding to it.
That we are only doing heads.
Yeah, and we also pandemic, we also emphasize hands only or compression only CPR. That means no blowing. Of course, as what Ms. Indrani said, if it's your own family member, loved one, and you know, because then you can blow, because compression and giving blows is more effective than compression alone CPR.
All right, I think that is all for our Q&A session. Thank you, Madam Indrani and Professor Dr. Jody, for the priceless information, fabulous answers. All right, this concludes our Q&A session as we don't have much time left. Now, let's move to our next agenda, which is presentation of the certification. As a token of appreciation, we are really honored to present a certificate of appreciation to Madam Indrani and Professor Dr. Jody for their collaboration in this event. Now, in order to capture some memories of this event, there will be a photo session carried out with the honorable speakers.
Oh, dear. We can't see ourselves. Can you see us? I want to know whether photo is there. My camera is in.
Okay, did everyone ready? Okay. 1, 2, 3, small. Okay, try again. 1, 2, 3. Okay, thank you.
Thank you. Down here I can see.
Thank you, everyone. Before we proceed to the narration, I would like to ask everyone for the previous time to visit our Instagram page, which is AMCCS_infographics. Kindly drop a heart on your favorite infographics and help us decide the winner of this competition, invested by the participants in creating these masterpieces. Your cooperation is very much appreciated. Thank you. Now, attention to all participants. A QR code will be projected on your screen for the merits of the participants. The attendance link will also be provided in the chat box. The link will only be open for 15 minutes. Participants can access the link in a given time.